as you know, I think it's something I feel quite passionate about. You've got a lot of conversation happening the last kind of 30 years or so around multidisciplinary teams, um, but that terminology is still very much viewed as a term which encompasses frontline professionals working in a multidisciplinary capacity. I don't see that as the end of the multidisciplinary team. I see the entire healthcare ecosystem being the multidisciplinary team and needing to have better connections with between individuals and between organizations, and also kind of, I guess, an improved level of respect for each other. And I think, as you touch on there, for the pharmaceutical industry, the relationship with clinicians has been fractious over the years, and there are issues there around trust. There's an interesting approach to engagement. So I think industry primarily engages the consultant workforce. So by that I mean kind of medical doctors who are consultants, but that's only 50% of the workforce. And whilst they might be kind of the leaders of implementation, there is an opportunity in my mind to kind of capture people slightly earlier in their clinical journey and build those relationships early on with a view to kind of what the potential offering of that is in the future. Um, so I don't see an alternative to improving these relationships. If you think about the situation we find ourselves in, where we have kind of an aging population demographic, we have increased costs of delivering healthcare, we have a shrinking budget. I think we have to start to find ways to work together, not only to make efficiency within healthcare better, but also to, I guess, change the dial a little bit in terms of thinking about how we deliver. Um, and there's a few things for me that are obvious wins there. So um, for pharma industry, I guess, to engage clinicians early, as I say, and take them on that journey to understand kind of health economics a little bit more, so that they can think about that within their practice. Because to date, I think doctors have had that fortunate position of being able to just kind of function with a purely clinical mind and not think about the economics. And I know that's not always a popular discussion, but equally, I think it's probably a realistic discussion for where we are now. That maybe no longer can we afford to operate or to function in that way at the front line. Um, and then I think the it also comes from the other side. So I've talked a little bit about the pharmaceutical industry needing to adjust and adapt their approach to clinicians, but vice versa is my view. Um, so as a profession, I think we need to start to think a little bit more broadly about what medical careers look like. The fact that specialist interests don't need to solely apply to therapeutic areas; they can apply to the wider healthcare ecosystem, and opportunities to be kind of that bridge that I was talking about before, be it into industry, be it into digital, be it into academia, into policy, into government. I don't see a reason why clinicians couldn't have that as kind of their diverse employment portfolio,